most of the providers here will be aware, but I just wanted to re-emphasize that uh, same-sex sexuality and bisexuality. So I'm using the term same-sex sexuality because nowadays people don't prefer the term homosexuality. So same-sex sexuality and bisexuality is no longer they are listed under psychiatric disorders. So in ICD-10, International Classification of Diseases, the 10th edition of World Health Organization, it was actually removed from the list of psychiatric disorders. Even in DSM, the Diagnostic and Statistical Manual of Psychiatric Disorders, uh, by the American Psychiatric Association, which is because these are the two manuals which are commonly used in India also. So in DSM. So in DSM also in 1973, it was removed from the list of psychiatric disorders. So same-sex sexuality and bisexuality are seen as normal variations of human sexuality. So that is one I wanted to emphasize. Another is in relation to the transgender people. So until recently, even in ICD-10 or in DSM, there was one particular category which they listed as gender identity disorder. So, but then in DSM also, they have changed the terminology from gender identity disorder to gender dysphoria in DSM-5, the latest 5th edition. Gender dysphoria referring to dissatisfaction or distress in relation to the mismatch between one's experienced gender and the assigned gender. But I would like to focus on the maybe we can say evidence-based and modern concept of looking at the gender identity as moved forward by the World Health Organization. That is the term gender incongruence. So the term gender incongruence is used in the forthcoming edition of ICD, the International Classification of Diseases, 11th edition, which will become operational from January 1st, 2022. So here again, the term gender incongruence is not listed in the chapter of psychiatric disorder. The gender incongruence comes under the chapter sexual health of ICD-10. So basically, even there is no reference to discuss there. It is basically the gender incongruence talks about the mismatch between one's experienced gender and uh, the gender assigned at birth. This is because many transgender people, they are very comfortable with their experienced gender. They may not be having the distress, but still they would like to undergo a medical procedure like hormonal medical support, like say hormonal therapy, or they may want a surgical procedure like gender affirmative surgery. So the presence of distress should not be a criteria for offering hormonal therapy or surgical therapy. So that is why I think the WHO's terminology, which actually emphasizes on self affirmation, self determination of gender identity, is more important. So so basically, the gender incongruence can be divided into two: gender incongruence of adolescence or adulthood, and gender incongruence of childhood. So I just wanted to show you uh, the definition of gender incongruence used by WHO. Of course, I'm not showing the entire definition. So the gender incongruence is characterized by a marked and persistent incongruence. Incongruence refers to the mismatch between an individual's experienced gender and the assigned sex. Of course, it can be assigned gender also, because in India we actually don't distinguish between sex and gender, because sex equal to male and female, gender is equal to men and women, but most often we use them as synonym. Uh, so coming back to the definition, so the incongruence between an individual's experienced gender and the assigned sex, which often leads to a desire to transition to hormonal therapy or surgery. So this is the broader definition of gender incongruence offered by WHO. For adulthood, it doesn't mention any time frame. For example, it doesn't mention that how long the person should be feeling like that. But in relation to the gender incongruence of childhood, WHO gives a time frame that this mismatch, that feeling should be present at least for 2 years. So that is the only difference between the gender incongruence of adolescent and adulthood and that of the childhood.